So hello to all my dear aspirants. Welcome you all to Sail to MDS Dental Academy. So now aspirants, this is a little different video. Many students are requesting that sir, we want some important words of wisdom before we go for the MPSC dental exam. Because many of you have are giving the exam after 3 to 4 years, or some are even like that they are giving exam after 7 to 8 years, or first time they are giving the computer based exam. So just I am providing in this video few important instructions, though you are knowing, but just additive points before you go for the examination. The first thing, the students are right now in panicking situation because the exam is there, like it was announced in the month of February or March, but the date was not announced. So many students are not in a race of a preparation. Some of have started and they have stopped, some have not started only because the exam date was not there. But those few of students who are in constant touch with us, they have done the preparation, but like that very few students are there. So remember, my dear aspirants, out of 100 if we take, 80 students have not started preparation. They have just started a 20-25 days back. So all are sailing in same boat. So you should not worry that okay, मैंने इतना पढ़ा है उसने इतना पढ़ा है. No, whatever you have done, that is enough for you. You should have a confidence on yourself. You should not compare that okay, मैं BDS हूँ या मैं MDS हूँ कि MDS वाला भी एग्जाम देगा उसको मेरे से ज़्यादा नॉलेज होगा या जो नीट दे रहा होगा. Nothing you should think. You should just think that whatever time I have right now, I should utilize them in going through the synopsis or our academy lectures are there and in practicing maximum papers, because you're going to give the computer based exam after many days. Now few students are asking me, sir, exam instructions kya hoga? Yes, negative markings are there. It is there. And whatever the other instructions may be there, you will go through it before you start the examination. Let's say when you go for the computer-based exam, the first 5 to 10 minutes will be filling your details and instructions will be provided to you. Then a very important basic thing, that reach your center one day before examination. Let's say your exam is on the 19th, try to reach around 18th afternoon or 18th morning. Don't just go directly on the 19th morning because the condition, weather condition is not good. So you may feel little drowsy or health wise. So please take care. Just try to reach one day before your destination, whatever the center is there. Then the big thing, that what you have to do during examination. First of all, you should be very calm and cool. You should not be very upset or you should not be very excited by seeing the question paper. It happens with many of my students, those who are getting NEET, government, any examination. जब हम लोग क्वेश्चन पेपर देखते हैं तो फर्स्ट क्वेश्चन वैसा आता है कि हमको नहीं आता, हम लोग डिप्रेस हो जाते हैं. सेकंड क्वेश्चन भी ऐसा है, नहीं आता, हम लोग डिप्रेस हो जाते हैं. तो जितना भी हम लोगों ने पढ़ा हो तो हमको लगता है शिट, मैंने मेहनत नहीं की. द माइंड विल स्टार्ट टेलिंग यू यू आर नॉट वर्क हार्ड, यू आर नॉट स्टार्टेड, टाइम वाज देयर. सो 3-4 क्वेश्चंस लेट्स से आपको नहीं आए, ओके, सो शुड नॉट वरी अबाउट दैट. लेट्स से 5th क्वेश्चन आपको आता है, 6th क्वेश्चन आता है, बट इफ यू कीप द गिल्ट ऑफ ऑल दोस 4-5 क्वेश्चन, you are going to damage whole your 100 marks paper. Fine doctor. And sometimes the opposite can happen. First 4-5 question ekdam easy hai, tumko aa gaye, you become excited and then you are end up in trouble. So I always tell my dear student that you should take each question singly. Means what? हर एक क्वेश्चन इंडिपेंडेंटली लेना है. लाइक फर्स्ट क्वेश्चन तुम देखते हो, तुमको आया, ओके, चलो, आया नहीं आया, ओके. सेकंड क्वेश्चन आया नहीं आया, ओके. टेक ऑल द 100 क्वेश्चन इंडिपेंडेंटली. किसी का अच्छा इफेक्ट या बुरा इफेक्ट दूसरे क्वेश्चन पे पढ़ने देना नहीं है. एंड बी वेरी काम एंड गिव द एग्जामिनेशन. डोंट थिंक दैट मैंने इतना पढ़ा है तो ये आया है. नो, वॉट एवर आई हैव स्टडीड इज द बेस्ट. तुम जितना काम रहोगे उतने ज़्यादा आंसर्स, ज़्यादा थॉट्स तुम्हारे दिमाग में आएगी. Sometimes it happens that if you are not studied also in your college time or when you are doing the patient, some or the other thing will, stuck to your mind. Okay. This was the irrigating solution I have used. There I have seen. The memory is such a good thing that suddenly the thing will pop up in your mind and you will answer. But when it is going to happen, when you are calm and when you are cool. But if you are very, tension, you are fuzzy, you are very excited, the things are not going to happen. And I always tell my students, when you go to exam hall, you are going to meet your friends, your juniors, your seniors, your batchmates. Don't try to talk. Save your energy, conserve your energy in approaching the paper, in solving the paper. Now, negative markings are there. So how many to attempt? Sometimes when happen that we are just 60-70 questions, we are confident that it is going to be right. You can take the risk of more 10 to 15 questions. Don't think that okay, 100 के 100 attempt करके आता हूँ, at least पास सही निकल गए तो भी चलेगा, नहीं, नेगेटिव मार्किंग्स आर वेरी 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 बैड थिंग. So don't try to attempt 100. Maximum you can attempt is 95 to 98 questions. Don't attempt 100 questions. Let's say if you are confident about 50 questions, try to take a risk of 20 questions more. But don't think that 50 questions आए मैं 40 questions का risk ले लेता हूँ, ऐसा मत करना. Negative markings will hurt your score. So remember, take a risk of 20% question. Okay, fine. So these all things aspirants you have to take care. And even after exams over, don't worry about it. The MPSC will going to announce the answer key and everything. Just remember that whatever the stipulated time you have given your best. So nothing more you think. Right now, just 2 to 3 days are left. Just go through the papers. Keep on practicing papers. That only the best thing you can do. And don't hold and take the book when you go with the exam hall. Try to make yourself as much relaxed as possible, because maximum you know the basic criteria of the examination was 1 year experience. So 1 year experience means you have worked in some other clinic, you have the clinical knowledge, and mostly the clinical questions will come. Okay, it may think that yes, for anatomy question, like I told you in the beginning also, you should be well versed with the blood physiology, with the classification of the carbohydrate, lipid, fats, with the anatomy, artery and the nerves. These few things, basics they can ask you, microbiology, sterilization. So just try to see in 1 to 2 days these things and just practice papers. Okay, aspirants, so that was all from my side. If anybody is facing any problem or anything is there, just contact me. Don't get disheartened, or don't keep your moral down. Have your head up. This is a good chance for all of you. Seats are maximum, so try to give your best. Okay, but don't try to make small mistake which can cost you the rank or hurt your score. Okay, so dear aspirants, that's all from my side. Any other help you need, just contact me. I'm always there for you. Till then, aspirants, take care.